So what happens if all of our teaching and prevention fails and this patient still comes to the hospital in an acute COPD exacerbation? Well, they're going to be so short of breath and everyone's going to want to intubate them and put them on the ventilator. But it's important to remember that non-invasive ventilation is safer for these patients. So that means BiPAP or CPAP is preferred over endotracheal intubation just because it's really hard to get them off of the ventilator once we get them on. So the first thing to try is non-invasive ventilation and stepping up their home medications. So our first line is going to be a combination SABA-SAMA like albuterol ipratropium, also called Duonab in the United States. And we're going to step up their inhaled corticosteroids to systemic corticosteroids like PO prednisone or IV methylprednisolone. But no matter how anxious they get, do not choose the option on the NCLEX that says to give them benzos or opioids. We're worried about depressing their respiratory drive. So if they get anxious, just coach them through pursed lip breathing instead. So while we've got them on non-invasive ventilation and we're giving them all these medications, we are very closely watching their ABGs and their respiratory status. And there are two things that would tell us that these interventions are failing and that we do have to go ahead and proceed with intubation. And do you remember what those are? Well, the big warning sign not to forget that intubation is required is going to be paradoxical respirations. So normally in calm breathing, our chest and abdomen rise and fall when we inhale and exhale. But if these patients get so worn out that they develop respiratory fatigue, you're going to see their chest walls start to suck in on inhalation. That's just because they're working so hard to get that breath in. So if you see these paradoxical respirations, definitely notify the healthcare provider because they are wearing out and they are not going to make it much longer on BiPAP. We need to go ahead and step up to the ventilator. And when you're checking their ABGs, remember it's expected to see a compensated respiratory acidosis, but if their pH does start to drop, that tells us that they can no longer compensate and they're having too much CO2 retention. So watch for these two warning signs. All right, so for your final NCLEX quick check, take a second and make sure you know meds and exacerbation tips. All right, so first, which medications are used to treat acute symptoms? Would that be SABAs or LABAs? Remember, it's our short-acting meds like albuterol that we need to use for acute symptoms. Which medication should you avoid in these clients with a COPD exacerbation? Remember, we are worried about depressing their respiratory drive, so you should not give them any benzos or opioids. And finally, what respiratory pattern indicates that intubation is required because they've decompensated? And that is going to be those paradoxical respirations where the chest wall sucks in instead of rising whenever they breathe in.